Welcome, everybody, to the Board of Health meeting of January 9th, 2023. Please note this meeting is being recorded and will be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet device. If anyone is recording this meeting, please notify us. Pursuant to Governor Baker's July 16, 2022, signing an act relative to extending certain COVID-19 measures adopted during the state of emergency, including the extension of the March 12, 2020 and July 15, 2020 orders suspending certain provisions of the Open Meeting Law, General Law 30A, Section 20, until March 31, 2023. This meeting of the Chatham Board of Health is being conducted in person and via remote participation. Every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling 508-945-4410, conference ID 896-471-742#, or they may join the meeting online via Microsoft Teams through the link in the posted agenda. While this is a live broadcast and simulcast on Channel 18, despite our best efforts, we may not be able to provide for real-time access. We will post a record of the meeting on the town's website as soon as possible. I'll turn the meeting over to our chairman, Dr. Noble Hanson.
It shall be the policy of the board to conduct. It shall be the policy of this board to conduct its meetings under the Open Meetings Law so as to encourage public participation whenever time permits and as part of agenda items discussions. So this afternoon we have 6 items on the agenda. There's another meeting occurring in the room at 4 o'clock, so they've asked us to try and finish up by 3:30. The first item is a request for extension from sewer connection order Joseph Amorosino, 14 Pondview Lane, and is
Joe is here.
Bill.
Joe. Hi, Joe.
I'm with you.
Yeah, who's wants to present the case for the extension for 14 Pondview Lane?
It's Joe Amorosino.
Joe.
I'm here. Yeah, I can present.
Yep, can you go ahead?
All right, I had sent a letter just to provide a little background, and I think I'll probably just read from that because it's clear and concise. Just in preparation for today's meeting, we are requesting extension on the variance allowing continued use of the cesspool at 14 Pondview Lane. We have planned to wait for the arrival of town sewer for construction of a new dwelling or making renovations to the existing home. Now here we are 1 year later, and the timeline for town sewer installation is a little bit unpredictable. It's supposed to start, last I had heard, in the fall of this year and potentially finishing in 2024, but we're in a situation now where we have to do some renovations to the home. We've got roof, windows, shingles, bathrooms. It's in disrepair, and I think we're in a situation where it's in our best interest to keep the existing home, not knock it down and build new construction as we had originally planned and pushed that out for a number of years. So, along with the request to continue using the cesspool until town sewer comes along, I also wanted to take a look at line number 2 of the original conditions dated November 16, 2021, when we met last year. There was a line in there that currently states the cesspool must be abandoned when construction begins for renovations or new construction of a dwelling. What we're requesting is that we remove the renovations piece of that line, which would allow us to do the windows, and other renovations to the home. While we're waiting. We had a nice report. The annual report on the cesspool is in good condition by the inspection, and we just believe that it's reasonable and fair considering that renovations and additions to other homes in the immediate proximity of 14 Pondview Lane have been done while they also remain on cesspools and await the arrival of town sewer. And I'm happy to answer any questions you have on that.
Yeah, Joe, so as I understand it, originally you were not going to use the home at all, but now you are going to use it, begin to use it some?
Yeah, so we used it last summer. We stayed limited use. You know, we went down and spent some weekends and some days there. And our original intention was to knock the home down and then build new construction. We don't want to build new construction before town sewer comes along, put in a big septic system, and then be in a position where we need to abandon it within a year or two. So we're now at the point where let's make some improvements, some renovations to the existing dwelling. Enjoy it for, say, you know, whatever, 3 to 5 years, maybe longer, and then come back and build new construction at a later date once we know town sewer has come to the neighborhood.
Okay, fine. And then I'd ask Judy, do we know, is there been any change to the estimate that the places, that road's going to be sewered in this coming year? There's no change any change we know of?
I mean, my last, that I heard, it was going to start this spring and into the fall, it would be started. Is Bob Duncanson on the call? I thought I saw him join.
Yeah, okay, and then, did you get a copy of the inspection?
In your packet, there's a letter from, I think it's,
Cape Septic?
yes.
Okay, all right,
saying
good.
that
So we have a copy.
they opened the cesspool and
Okay.
it was in decent condition.
So I'd open up to discussion and questions from the board about the extension.
Joe, this is John Beckley. Just a quick question. You're not anticipating moving into the house full-time at any point? In other words, you're going to continue to use that existing cesspool in a pretty limited way until you have the new renovations done?
Exactly, yeah. We live full-time off Cape and we use the house during the summer. I can say with a great deal of confidence, the usage will not be more next summer than it was this summer.
Okay.
And I was happy because it was our first year of ownership and really didn't know what the inspection would say when we had it done. And the fact that the previous year it came in fair to good and that this year it came in at good with similar staining levels in the pool and that the cesspool was essentially empty, I think the report says. I feel like we're in a good, safe, responsible state right now with that cesspool.
Thank you.
Other questions or comments? Can we get a motion for that request for extension?
I will so move.
And a second, Ronald second. And I guess the motion would be to remove the language which says cesspool must be abandoned when renovations begin. I guess that's
No.
the,
And continue annually pumping and inspecting the cesspool. I would include that.
okay.
Well, you're going to have it read, the cesspool must be abandoned when construction begins for a new dwelling.
Yes.
Okay.
Well, for renovations. Oh,
But
okay, right,
You don't want to have
correct.
a link there between renovation and removal.
exactly.
Okay.
Right.
Yeah, that would be part of my motion.
Yeah, okay. And then,
Comments from the public?
yeah, we never did a quorum.
Oh,
Yeah, so I guess we just sort of back up and make sure we have a quorum.
we jumped right in.
So I'll take a roll call, and if you are here, please say Ed Sheehan. Ron Broman. John Beckley.
Here.
Carol Boyce. Here. Noble Hanson here. Okay, good.
So
Questions?
the motion will be to provide the variance for a 3-year extension. Oh, no, I'm sorry. I'm misreading that. Okay, just motion to approve the variance as requested with the wording changes relating to the, to the renovation. Okay.
Okay, I think we can take questions from the public? I hear none, so we can take a voice vote, I think. All in favor of the extension? And the new language, say aye.
Aye.
And opposed? None? Okay, so that request should, extension should pass then, Joe.
Thank you very much, and thank you for your time today and for listening.
You're welcome.
Thank you, Joe. I'll send you a revised letter.
Thank you.
Okay, so the next variance hearing is for the Fitz Family Trust, 208 Cedar Street, Clark Engineering, and I believe Mr. Clark is here.
Good afternoon. Happy New Year. David Clark, Clark Engineering, on behalf of the Fitz Family Trust. This is a recent transfer, and regardless of that they're proposing additions, the existing sewage disposal system has to be upgraded in that it's cesspools. The cesspools are currently located at the rear of the building, well within the 100-foot setback to a vegetated wetland. So the proposal is to upgrade to Title V. The new system is proposed in the front yard, basically the southeast corner of the property. It's the only available area for a Title V system, and there's not enough area for a total Title V system, so we're here asking for variances. Basically, the variance to the easterly butter sideline, as well as to the foundation of the dwelling. None of the additions to the dwelling impact the location or the variances that are being requested. In that the variances that are being requested are to the existing foundations, which coincide to the foundation of the addition. The owners were hoping that sewer would be available at this time or close. But for some reason, Cedar Street is languishing in the design phase for several years now. So more than likely, we will be installing this system rather than waiting for the sewer. The project also needs conservation review. We're scheduled to go to them this coming Wednesday. It has been to Zoning Board of Appeals and got approval for the additions. So I'd be happy to answer questions.
Okay, so no increase in bedrooms and an upgrade from the cesspool to a standard Title V septic
Yes.
system. Any questions from the board, or John?
Looks good to me.
Yeah, it looks to me like the new septic system is farther away from the wetlands than the cesspool that's being abandoned, so that's
That's a good thing.
That's good, and it's a new system, so it looks pretty straightforward. Motion to approve from Ed.
I'll second that.
Okay, and then any input from the public? I see none,
You
so,
want me to read the conditions?
yes, please read the conditions.
There's only three. The applicant should restrict the property to a maximum of 4 bedrooms and record the restriction on the deed at the Barnstable County Registry of Deeds. The applicant shall submit a copy of the executed deed restriction to the board. The engineer shall submit an engineered as-built plan, including as-built elevations with a written certification that the system has been installed in accordance with the approved plan. No revisions to the proposed floor plan of the dwelling will be allowed without further review by the Board of Health or its agent.
Okay, I think we can probably take a voice vote on this, so all in favor say aye.
Aye.
And all opposed say no. Okay, I think it passes, and the variance is
Thank you
yours,
very
Mr.
much.
Clark.
All right. Zooming right through.
Okay. Okay, the third item on the hearing is variance approval of IA Technology for Jeffrey and Ann Elton, 66 Billings Road, Coastal Engineering. And.
Good afternoon. Good afternoon. Sean Riley, Coastal Engineering, representing the applicants.
Okay, good. Go ahead and present, please.
Very good. So there is an existing three-bedroom house with a three-bedroom system. Judy, I'm assuming you received our email with the updated existing floor plans showing the three bedrooms.
You have it in your. You have it in your
email?
packet, yep.
Okay. So the proposal before you is to tear down the existing three-bedroom house. You can see on the screen the existing three-bedroom system, tank, D-box, and field are located between the 50 and 100-foot buffer to a coastal dune, which is the 50-foot buffer is the red line, and the 100 is the blue line. The proposal is to shift the system as far away from the dune as possible on the lot, entirely outside of the 100-foot buffer, with a four-bedroom system with the IA component of a fast unit, and to go to a four-bedroom system. So we're seeking a variance to upgrade to a four-bedroom. We meet all other setback requirements for the tank and field, so the only variance would be related to the additional bedroom. With that, I'll open it up to any questions you may have.
I want this property.
Okay, any questions or comments from the board?
I have a question.
Yes.
I've been looking at the plans, and the study that's here also joins a full bath. It looks like there's like five bathrooms with showers throughout the house. I was just wondering about that study area.
The study area adjacent to the primary master bedroom?
No, it's on the first floor plan.
Okay, let me jump over to that.
And I was just
Yes, so
wondering,
that's-
that's a lot of bathrooms, and I was wondering about that study, if that's
Yeah,
going to
that
turn
has
into a
a-
bedroom.
Yeah, no, there's no intent to open that up or turn that into a bedroom. There's a 6-foot cased opening with no doors on that study.
So this is another example of what we see all the time, that we have cased openings that can easily be closed off in a matter of minutes, and and another full bath with a shower. So this house has 4 bedrooms and 5 showers. One shower right next to this study that isn't a bedroom because it has a cased opening, otherwise it would be a bedroom. And it's disturbing, because there really isn't any reason to have a shower there unless they're planning to have people sleep in that study.
If you count up the total number of rooms and divide by 2, you get 4, so.
Right.
That meets with
right.
our
It doesn't
regulations.
fail by that count.
And it doesn't fail by the fact that it has a 6-foot cased opening, so we don't have any rule about bathrooms, so that's, we
No, I
let.
know, I understand that according to the letter of the rules, this is not in violation. But it raises this issue that we see over and over and over again, that bathrooms are being put in next to, quote, studies and libraries and sewing rooms, that according to the plan are not going to be used as bedrooms, but then the question is, why are they being designed in this way? The other issue that I might as well raise is the state is now suggesting that all Title V septic systems be converted to innovative alternative systems because standard Title V septic systems aren't providing the level of protection that the state wants to see. So here we are taking a three-bedroom house and allowing them to put a 4th bedroom in with another room that's questionable, with an innovative alternative system, so that this house with the innovative alternative system will be producing roughly the same amount of nitrogen as the three-bedroom house with the standard septic system. So,
We don't know that.
well,
No, I mean,
so the
our
state has no plan to take buildings that have been allowed to add additional bedrooms because they put an innovative system and allow them to continue with that same innovative system under the new plan while they require everybody else with the standard system to upgrade to innovative.
Our nitrogen loading regs allow you to add an extra bedroom if you put IA in, because we've shown when the nitrogen loading calculations are done, that you have less nitrogen load with a extra bedroom and an IA system than you would with a conventional system, with the less bedroom number.
No, I realize that. And that's
So-
why we're allowing these
Right.
places to add additional bedrooms. But clearly, the intent of the new state regulations is to make things better. And so if we've already allowed an additional bedroom because it's got an innovative system, then how are we gonna make
Well,
that
they allow that
better?
as well when you put an IA in. If you meet the, if you're in one of those zones, there's a standard that you can meet to add an extra bedroom by your nitrogen loading calculations. It's depending on the system that's used. So that's why we've gone down that road. You know, I understand what you're saying, but because we're in the middle of, sewering the town, we've already accepted the fact that we're gonna be sewering 2/3 of the town and eventually the whole town, and allowing extra bedrooms. And we feel that we'll still be able to meet the state's requirements for nitrogen by doing that. I don't, unless we go back and take another look at our nitrogen loading regs, I don't see how we can change course in the middle of things without some more discussion.
Well, do we know that with this proposed recommendation to upgrade, that if you already have an IA system, that you're going to have to change that again with these new
No.
rules? I
No,
don't think
no,
that's-
no, you're not. So that's
not.
the issue.
Right.
If you're allowed to put in another bedroom by taking a standard system, making it a IA, so that's because then with IA and 4 bedrooms, you'd have roughly a little bit less nitrogen than the 3 bedrooms with the standard system. But now, they want it to be better than that. They want it to be like if this house stayed the way it was with 3 bedrooms and a Title V system, they'd require them to upgrade to IA under these new rules that are coming through.
Yeah.
But we've already allowed them to add an extra bedroom by putting in an IA system. So how is the state going to deal with
So
that?
you're saying that new rules would require someone to upgrade to an IA system without getting the extra bedroom?
Right.
Not necessarily.
I don't
I'm
know.
not sure
That's-
that's
yeah.
true.
I'm not sure
Through
that's.
the chair, yeah, that's not necessarily true. Just a little bit of background. So the reason you would ask for IA through the state would be if you were in a zone 2 of a water supply, or you're in another area that required the addition of that to get the additional bedroom. Chatham, a long time ago, took a higher standard to protect the embayments and basically introduced the nitrogen sensitivity throughout the whole town for their estuaries. So essentially, you're not going to need to upgrade when they bring in the regulations. They're just coming up to speed with where Chatham came to in the past. And just to give you an idea of, let me just share my screen here, of where we are in the world. Can you see my, let me just, hold on, let me stop that and just share. So again, the reason why they're introducing this is the towns aren't acting quick enough to help out all of the estuaries that are impacted with excess nitrogen. Pleasant Bay is one of the most critically impacted estuaries on Cape. But this area right here, the 66 billing, is essentially on the ocean side. So there is no impact in this particular case for nitrogen removal. There is no standard for nitrogen removal for this area because there is no embayment over on this side of Chatham. So it's really a moot point in this case, but I understand where you're going with the rest of the town. But really, it's the state coming up to the Chatham standard. So you guys should applaud yourself for already being way ahead of the game.
Yeah, I think my understanding is that Dr. Duncanson's very hopeful that our current sewering plan will allow Chatham to get a
Waiver.
a waiver so that these new rules won't affect Chatham at all. I think because Chatham is way ahead, and he says that the state came to him early on to find out information, so that's good. I'd have one comment about this study. So it has a 6-foot arch, which we required. It looks like the bathroom opens up to the hallway, not to
Yes.
not to the study
I
itself.
was going to say that, too.
So, but we don't count bedrooms. They did comply with the 6-foot arch, so to me, they're basically
Oh,
doing
no,
what we have
absolutely. By
asked.
the letter of the rules, it does
Yeah.
comply.
Well, you've got to allow somebody that wants to have a study too, you know? And I think the fact that there's no direct opening from the study to the bathroom
Actually,
is evidence of good faith by the architect, not
my plan
correct.
shows that, not a bathroom, but a laundry.
No, the
Oh, okay. Oh, that's on around
But
the
again,
corner.
the door is by the front door of the house, so,
Right.
it's not
Yeah,
very
that's
convenient.
around the other side of the house.
Coming
And if
back to
they're-
the beach more often.
Yeah.
I'd be more suspicious if there was a direct access from the study to the bathroom.
I'm just wondering if that could
Which
turn into
you're-
a half bath, because there is a full bath over on the right-hand side there that adjoins the guest room, so maybe just a half bath
Yeah.
would go there instead of a full.
Right.
Then we had no worry whatsoever.
There was a fascinating article in, I think it was January 1st, in the New York Times, a whole feature article about trouble in Cape Cod relating to septic impacts. Yeah, it was related to what's happening in a part of Mashpee. And I just looked, I sent it to you, but I must not have gotten to you, Judy. But you're going to get a copy of the article, because it really hit home for what we're working on a regular basis, to get this little glimpse into what can happen and is happening in at least part of Cape Cod right now. And it relates to the nitrogen loading from the septics, coupled with the climate change increases in summer temperature. And that's the killer on top of the nitrogen, is that the warming temperatures are cooking this in a very bad way during the summer months. And the ponds that have been really impacted upon in Mashpee that become cloudy and unswimmable in the summer, or crystal clear in the winter, they convert all the way back. So it's just an interesting situation that the article focused on. So we'll all get to read that soon.
Well, it sort of relates to the short-term rental issue, that there are just too many people using septic systems and making too much nitrogen in Chatham. There really isn't anything we can do about it if it's family members, and if the people who come to us and say they want to go from 4 bedrooms to 5 or from 5 to 6, only have family members. They can have 30 people in the house if they want, but it is creating a problem. And we may be able to do something about short-term rentals, but doing something about how many family members can come and stay in your house, near Harding's Beach, is going to be a problem. And yet we continually see these houses with more bedrooms, more bathrooms, that are really, likely to be attracting more visitors. If they're not renting, there's nothing we can do about it
Yeah.
at this point.
Yeah, so we'll talk about the working group later on, but for Sean, I would make the comment that, so the new IA system is farther away from the coastal dune than the old system, so that's
Yes.
a big plus.
Yes.
And if there aren't other comments on the variance, I ask the public if there's input. And I don't hear any, so does somebody want to put forward a motion for the variance.
I'll make a motion that we approve the variance.
And a second? Carol seconds.
With the conditions outlined in Judy's memo of January 4th.
So Judy will read the conditions.
The applicant should restrict the property to a maximum of 4 bedrooms and record the restriction on the deed at the Barnstable County Registry of Deeds. The applicant shall submit a copy of the executed deed restriction. The applicant shall sign a covenant with the board agreeing to comply at such time as the town of Chatham through its Board of Health and/or Board of Water and Sewer Commissioners directs the connection of this property to the municipal sewer when it becomes available. This covenant and deed restriction shall be recorded at the Barnstable County Registry of Deeds. Throughout its life, the system shall be under an operation and maintenance agreement. This O&M shall be for at least 1 year and may be with any mass-certified operator of the appropriate grade who has received training by the company on the operation of the system. Effluent of the system shall be monitored at least twice per year for the first 2 years, preferably May and October. The effluent shall be field tested in accordance with Mass DEP standard conditions for secondary treatment units certified for general use, revised March 20th, 2015. In addition, a lab test of effluent for total nitrogen to meet the performance standard of 19 milligrams per liter shall be collected and analyzed by a certified lab. Water meter readings are to be provided with the semi-annual report. If any of the field tests or lab tests fail, follow-up tests shall be conducted by a certified lab and an evaluation made by the operator within 30 days. After the required 2 years testing, the application can be made to the board or their agent for review and possible modification of the monitoring requirements. The applicant shall apply a minimum of 6 inches of compacted topsoil to all disturbed areas of the property. The engineer shall submit an engineered as-built plan, including as-built elevations with a written certification that the system has been installed in accordance with the approved plan. No alteration to the floor plan of the dwelling or engineered site plan will be allowed without further review by the board or its agent. The variance granted pursuant to the state environmental code and the town of Chatham subsurface sewage regs is valid for 1 year from the date of the Board of Health approval. A permit must be issued and work commenced during that 1-year period, or the variance shall expire.
Okay, so I think there was no public input, no public questions. So I think we can probably take a voice vote also on this one. All in favor of the variance for 66 Billing Road, say aye.
Aye.
And of those opposed? Okay, so that variance is granted.
Thank you all. Have a great afternoon.
Thank you.
Okay, so the next on our schedule is an update of the short-term rental regulation. And I think Judy can probably give us an update on the last working group meeting and where that stands.
So at our last meeting, I'm not sure if we met after that. So we had reviewed the registration form that we talked about at our last meeting and the draft regulations that I'd put together. I think it was a good exercise. We went through the registration form, and by doing that, before looking at the regulations, it made it very clear that we needed something to refer to, being the regulation. I think some of the members felt that we should just do a registration without have a regulation first, or without a regulation to back it up, but it's pretty clear when you're asking for all this information on a registration form, you really need a regulation to back it up. So I thought that was good. We have one more meeting scheduled, hopefully our last meeting, which is next Tuesday, the 17th, and we will be going through the regulation again. And hopefully we will make take a vote to send this back to the select board with the recommendation that it be sent back to the Board of Health as a regulation for the board to take action. We also, Bob put in the budget, a placeholder for a full-time inspector and administrator. The select board had a meeting last week where they looked at all the different department requests for employees, And they didn't take any real action on this because they wanted to wait until they got the regulation and the recommendation from the working group. So hopefully by the end of the month, we'll have that ready to go.
Yeah, I had a question about the funding. What does a placeholder mean? Does that extend the decision past the normal deadline, or what does that mean?
I don't know that it extends it. It just lets the town administrator and her staff and I guess the selectmen, the select board members that this is something that may be coming across their desk. I'm not sure it extends it. I think we're going to have at some point going to have to get it to them so they can vote for approval and then, or recommendation for approval, and then also the finance committee will see it as well.
The other question was kind of a process question. If we voted, I don't think we should do this, I think we need the registration and the backup regulation, but if the board voted just for the registration form, wouldn't we be passing a regulation technically anyway?
I guess, I think so.
I
mean,
think so
it would
too,
be-
so I'm thinking that to say the registration and then the second page is to differentiate them, I think they're both done by regulation in a sense.
Right, I
So
mean,
it's
if
kind
we're
of-
going to require it, it has to be some type of a vote that we require it, so.
The other big thing is funding that's going on, and it's the timing, the working group is taking a while, it's a big group, but it's doing its good work, I think, and the funding is going on at the same time, so that's something we have to deal with.
Judy,
So have we now decided that we're no longer pushing for a bylaw?
Correct.
It would have to go to the town meeting. We're gonna do this as a Board of Health regulation.
That's what it
And we
seems to-
will go to town meeting to try to get funding to support the people who will manage this.
Right,
Because that's a
right.
huge difference, to not have to
Yeah,
have the town meeting pass a bylaw
right.
to do this. And then the question is, if you're going for funding, that's not a two-thirds majority vote, that's just a majority, the way that would be done?
It would be part of the budget, so.
Yeah, this wouldn't be a standalone item, this would be Dr. Duncanson as part of his departmental budget, which is big, he's asking for another position too. He's put in for this position for the health department to act as an administrator for the STR.
So this wouldn't
So that will
fall
go-
under
that-
one of
that-
those things
if it
that
gets
requires a
Yeah.
two-thirds majority?
No.
If it gets approved by the process, then it goes into the whole town budget and it just gets approved as part of the whole thing, that's my understanding.
Yeah.
Sounds good.
John?
I was just wondering how many other departments are requesting additional personnel in this upcoming budget?
I think there's.
I think there were maybe 10 or 12.
10 or 12.
Okay, is that uncommon, or is that common, or?
After COVID,
I'm
after
not
COVID,
sure.
I think there was none during COVID, and now there's a kind of a backlog.
Yeah,
There's a big
I
number.
think this is a substantial amount. I know that they're looking for a mental health counselor through the police department to work with the police and our human services group. And the select board was very supportive of that, and they actually said, we think you should get two. So they're supporting even an extra person above what was requested, so they can separate it out to there being a youth counselor, which I think is very, very good as well.
Yeah.
So, yeah, I mean, I think there are a lot of people this year.
But I'd say that it's not like there's just 2 or 3 or 4 positions, there's a long list.
Okay.
And I think they're in the position where they're going to be funding a number of positions.
Yep.
And not just picking 2 or 3, so it's not like they have to choose one or the other. I think I'd make the case that that Dr. Duncanson's request for this person should stand by itself, for consideration, not a
And
choice
I'll-
between one or the other.
And also, the select board, I think, realized that this position will be self-funding after we get going.
That's something we have to emphasize.
There is the tax that we collect on short-term rentals, and then we'll also be assessing a fee, and, basically administrative fee for covering
That's a very significant point that will contrast with
the other
the
positions.
other requests that are going to be for future
Right.
ongoing funding.
So,
Yeah, in my mind, the question came up of, is there something the board can do to help with the funding process, with the funding as it goes through the process? I think there's a public input section for the select board to look at each position that's been recommended to be filled, so I'll be there to make a presentation. I'm sure Judy will be there, be available. But is there anything else we can do? The Finance Committee, we could have a representative go before them, but,
Yeah, I think just,
I mean,
responding to, or being there when they discuss the certain positions and being able to support our request is probably important. I mean, we could, at some, perhaps put something in writing as, in support of it, if we wanted to send it.
recommendation or something. that went to
Recommendation
the
in
Select
writing.
Board and the Finance
Yep.
Committee.
I'm hoping if we get a positive vote from the short-term rental group, that, that will go a long way towards supporting this position. Because you can't, we can't really do it without a staff person, so
Is it one FTE?
that's what we're asking for.
Okay.
And then if it gets, there was some sentiment among one of the select board members that it would be too big for even one person, but I think once we get going, and then after a year, and we could probably, readjust if needed. So,
But I think it's also good to emphasize, this isn't a position that's going to be an ongoing
Yep.
cost to the town. It's really a startup cost, and then the estimated fee is $125. There's estimated 1,300 rentals, that's $160,000. So once it gets rolling, that amount of money would fund the administration of this thing, and would there be no net cost to the town, so that's important. And I think we've tried to make that point. Okay. So I guess
so we're still kind of in a holding pattern until next week's meeting. So at the next Board of Health meeting, we should have more info.
And your meeting on the 17th, you're going to take a vote on the regulations, or?
Hoping,
Hoping, yeah, that's our hope.
yep.
We'll have a motion and it'll pass.
I mean, I think everybody, we've kind of gone around in circles to a certain extent, and we've had some really good discussions, and I think we now have, I think everybody feels like we've cut to a point where we can agree on something. So, it seems like we have a fairly good support of this where we're at right now.
Okay, other comments? Any comments from the public on the short-term regulation process?
I don't see any.
Okay. All righty. The next item on the agenda is the 32 Mill Hill Road nuisance cleanup. And maybe Judy can fill us in on the Mass Department of Environmental and Pollution, where they stand with this. and
Yeah,
then-
I have not heard back. He did tell me the last time we spoke, he was hoping, the first week of January or so, he would get an answer, on the order, the order that he's going to send to John McGrath. So I don't have any update from DEP at this point. I did speak to Andy Goddard and the DPW acting director. The signs are in order for the no parking. He's been waiting for them to come in. As soon as they get in, he's gonna get them installed as soon as possible. And then Andy said, once the signs are installed, then they'll start enforcing the no parking. So
And that will keep that whole space open, that whole shoulder.
yes,
Okay,
they may even be saying no parking on both sides of the road. So,
okay. Good.
yeah.
So the DPW is waiting for the signs to come, and then they're going to move ahead.
Yeah, they ended up sending them out.
Andy Goddard had told me, once the signs are up, they can inform the neighbors, and then they can begin policing
Right.
no parking. So that's
Right.
the process there.
Okay.
And so we're, just to summarize, we're at the Phase 1, which was cleaning up the roadway. That's been done, and the guardrail's up. And then Phase 2 is cleaning up the property itself, and that's what the Michael Whitesides is looking at. And he has determined that it is, to him, in his opinion, an illegal dump. And he's and there was no significant progress in cleaning it up after a couple of follow-up inspections. And he is now going to his superior with all that information so that a decision can be made on the next step by the Mass DEP. Now, the Board of Health, we haven't given up any of our authority. I felt that we should let them carry through with what they're doing, and then we'll see where it is and make our decision from there. So I think is there any other questions or anything I've left out? No. Okay. COVID-19 update. I don't know if Dr. Dunkson is here or not.
Yeah, I don't believe he is. I don't have any numbers. I think the last report I got from the state last week was that we were saying about even. Again, we haven't had any sharp spikes, at least in our reported cases, as we all know. Not many people are going and getting PCR tested these days. We are still handing out at-home test kits. Then we had quite a bit of takers right after the holidays. We do know, the rates in Boston have shot up significantly, and they are requesting in a lot of areas in the inner cities that people wear masks to schools, and they're recommending it. No mask requirements, but a lot of
Really?
recommendations. So, but around here, as I said, it seems to be kind of on an even keel. I haven't seen
Well,
any sharp.
that's good news.
I have not looked at the hospital numbers, but I haven't heard, had any.
But after the 2 holiday seasons for our town numbers not to have spiked, that's encouraging
Yeah,
for COVID.
right. So,
I think that it was interesting, the Boston schools wording they had made, that wasn't a recommendation, it wasn't an order. They used the word, they had the expectation of wearing masks, which I thought was a whole new word that nobody really knows what that means. So
Yeah.
that kind of tells you where they're at.
This new variant, the 1.5.5, is supposedly significantly more transmissible than Omicron. And the disturbing thing is that the monoclonal antibody therapy that was very effective against the earlier strains is not at all effective against this strain. And so any elderly person who's immunosuppressed, who for one reason or another cannot take Paxlovid because they're taking cardiac drugs or something that do not allow them to take that drug, there's nothing now to treat
Right.
them with. And so the concern is we may have a lot of trouble in that regard because there's no drug for them. And again, the positivity rate was up to 13.5%, I think, I don't know where that was, it's Massachusetts, but it was quite high. And there's a lot of COVID around, and that's what's driving all these variants. That there's just a lot of COVID, a lot of people getting COVID. They're not dying, they're not getting sick, but there's a lot of COVID, and that's going to make more variants. And the concern is someday we may have a variant that's a really bad variant, that's transmissible and deadly.
Well, they're worried about China.
Yeah, there's China. I mean, China has ineffective vaccines, and very few people are immunized because the vaccines weren't very good, and they had no COVID policy, so people didn't get it. Now they say there is no more no COVID policy, so everybody's getting it.
yeah.
And then we say, well, they can't come to this country because they may have COVID, and that's creating a lot of problems. So it's of concern, and it's of concern, but you go to the Stop and Shop, you don't see anybody wearing a mask.
I saw you wearing a mask.
Well, yeah, you see me wearing a mask. But because I don't want to get everybody I know, all my neighbors, a lot of my relatives, they've all had COVID. The person across the street had COVID 3 months ago. She still feels terrible. She's still coughing like crazy.
Yeah, right.
They just put her on amoxicillin. And she refused Paxlovid because she didn't think COVID was a serious illness. So it really is a concern.
Dick, do we know, or do you know what's been written about whether this new variant makes people sicker or not?
As far as
Or
they
is it a
can
mild
tell,
one?
it's much more transmissible, but it's
No more
not
serious.
terribly severe in terms of
which is
inducing
important.
hospitalization and death. That's the good thing.
Okay.
Not to be, well, my daughter was sick, and I think she had the flu. She didn't have COVID, we tested her, but she had a very tough febrile illness that lingered for probably 10 days with a bad cough. Thank goodness she had her flu shot,
Yeah.
because that reduced the severity of it. But
My
that's-
hot tub repairman delivered a new top for my hot tub the other day, and he was coughing like crazy. He said he's been sick for 3 months since his nephew coughed in his face, and his nephew was diagnosed the next day with RSV. And so here's an adult, many adults that don't have any immunity to RSV, they never had it, and he's had this lingering, deep, not productive cough for going on 3 months now.
Wow.
So, you know, so now we've got flu, RSV, and COVID all at the same time.
I did receive, we're still recommending vaccines for COVID, the booster shots. And I did get an email today that the VNA is having a clinic for 5 to 11-year-olds. So anybody out there that may be listening, you can call the VNA at 957-7423, or they can call the health department and we
This is
can
for
put you in
COVID?
touch. And this is for COVID, the bivalent boosters, and it's going to be January 24th between 2 to 5. So one day, they're going to have 3 hours where they're going to hopefully get some school-age kids in there. So if anybody needs more information, they can contact me at the health
Is there a
department.
reason we never bring the clinics over to the schools?
We do bring them to the
we?
schools.
Okay.
Yeah, I mean, we can do that. We've done it the beginning, and we did do it for the kids. Last winter, I believe, we
Okay.
did, when they first came out with the vaccines for the school-age kids. VNA is good with the kids, so, but we did a family clinic here, it was a drive-through, so we had quite a few families come through with young school-age kids. So we will, if there's a need for it, if the school nurses want to do it, if they think they can get enough people, we definitely can do it.
Okay, thank you.
Okay, good. And again, Judy said that there are plenty of home COVID tests that they are handing out for free if you contact the health department. All right, I think we
Good.
finished the COVID update. Comments from the public on COVID? And then the last item is Board of Health, the reorganization. Ed Sheehan is going to rotate down and become an alternate member, and Dr. Richard Edwards is going to become a full-time member. And we'll take a vote on that if everyone approves, and then we can pass that on to the town. It becomes official, and at the next meeting, that change will be in effect. So
Okay,
we can just take a simple vote?
I think we can, yeah, maybe someone just make a motion and, yeah, and then we can take a vote.
So a motion that Ed Sheehan become an alternate member and Dick Edwards become a regular member.
I'll make that motion.
Carol makes the motion, a second,
second.
and then I think we can take a voice vote on that. All in favor, say aye.
Aye.
Opposed? Okay, so next meeting, we'll make that change.
Ed, how many years have you served on the board?
19?
Probably 32.
No, I mean, I think you started right when I started with the town.
I don't know, I've been here
I think it's probably about 20, 19 or 20
Well,
years.
thank you for all those years of
Well, he'll
of
still be here.
service. I know, but I wanted to,
Still be scratching.
all right. All
Can't
right,
get rid of that easy.
thanks.
Well, I've got a brother-in-law that just passed away.
Okay.
Go ahead.
Yeah, it just passed away, and he went through hell. He got some kind of a respiratory thing, including, I can't,
COVID?
there's so much talking about him.
Yeah. Okay.
So anyhow, he's in the ground now.
Jeez.
Well, we're sorry to hear that. But we thank you for everything you've done, and you'll still be here, a part of the team, so that's great.
It's great.
I think we can move on unless someone has something to bring up, we can go ahead with
Minutes?
approving the minutes from December 19th. Any changes or suggestions or comments?
I'll make a motion, we approve the draft minutes from December 19th, 2022.
Second.
We have a second? Okay.
Ed's last.
We can take a voice vote, I think. All in favor of approving the minutes of December 19th, say aye.
Aye.
Opposed? Okay, those minutes have been approved. And then, can we get a motion to adjourn the meeting?
Motion to adjourn. Yeah,
A second?
Second.
All in favor, say aye.
Aye.
And opposed, say no. All right, we are adjourned.